rolling.
Okay, all right, so this is the Preventative Medicine Vaccine Memory Palace. So we're starting outside. We're going to be doing COVID-19 first. All right, so we have 3 guys out here playing Frisbee. Our first one is John, who used to work for Pfizer. He's always buying crazy tech, so Pfizer buying tech. He is going to throw his Frisbee once, so that's 1 dose, to Jason. Jason, the modern man, this is Moderna, all right? He is going to be throwing his Frisbee once to Isaac, okay? And John and Jason are Mr. John and Mr. Jason. They are mRNA vaccines, okay? Isaac, he throws like a supernova, and he is throwing 2 Frisbees. He's throwing 2 Frisbees at once because Novavax supernova is 2 doses, okay? He's also wearing spiky boots, spiky combat boots. So this is a recombinant spike protein vaccine, okay? So after the 3 of them are done playing Frisbee, they're gonna sit down, they're gonna watch a movie together, okay? This movie is rated PG. The contraindication for COVID vaccines are if you have an allergy to polyethylene glycol, all right, PG. The movie they're watching is quite heartwarming. So the adverse effects of the COVID vaccines are myocarditis and pericarditis and an inflammatory response. And that is going to be within 3 weeks because there are 3 people playing Frisbee. One other thing, John is wearing the number 3. If you're immunocompromised, you can get BioNTech/Pfizer, but it's a 3-dose series. Jason, the modern man, is flexing. So if you are immunocompromised, you can get Moderna, but it's a 2-dose series. Did I forget anything? All right, let's head on inside. Three down, 32 to go. This is open.
I know.
Okay, so now we're at the cafe and we're gonna be talking about influenza. As soon as I get to the register, the cashier is going to spray flu mist up my nose 4 times. So this is a quadrivalent vaccine. It's quite lively as well. So this is a live attenuated vaccine. After that happens, she says, that'll be $249, please. I'm like, what's happening? So this is for ages 2 to 49. You don't want to be pregnant at all in general with flu vaccines. All right, so this is flu mist. We are going to come over here because this is a live attenuated vaccine. There's going to be some contraindications here. So over here we have 2 17-year-olds popping some aspirin. So between 2 and 17 on aspirin, do not give flu mist. Then I'm going to go up to them and I'm going to rip their spleens out. Okay. As I rip their spleens out, I'm going to nick their CSF. So a splenia, a CSF leak, and their CSF is going to shoot into my ear, a cochlear implant. These are all contraindications for the live attenuated flu mist. Did I forget anything? Yeah. Oh yeah, I said, yeah, you don't give it if somebody's pregnant. Okay.
And it's not that you don't give a flu vaccine to someone who's pregnant, it's that you don't give live attenuated.
Yes.
The
good.
flu mist.
Yes, okay.
Specifically.
Yeah, very good. Here, one of you sit down. Now I'm going to take a seat. This will be real quick. I have a friend here. I'm going to sell him a flu vaccine. This is called FluCellVax. Okay, but I'm actually going to sell him 2 4-wheeler quads. So this is, you have to be at least 2 to get FluCellVax. Is that correct, guys?
Mm-hmm.
You have to be at least 2 and quad because it's quadrivalent. That's FluCellVax. Okay, all right. Let's get inside. So now, busting through this door is Frozone from The Incredibles. This is our Fluzone vaccine. He's going 4 times as fast as the other vaccines. This is a high dose, 4 times the amount actually, vaccine. Incredibles came out a little while ago, so he's over 65, so we're giving this to anybody over 65. Okay, Mr. Incredible comes in as well, shows him an ad for the new Incredibles movie. This is flu ad. Mr. Incredible's older as well, so this is greater than 65 as well. Okay, now Syndrome comes in, who's the villain of the Incredibles. He's gonna block both of these guys, all right? So this is flu block, and he just turned 18, so you have to be at least 18 to get flu block. Everything other than flu miss, these are all inactivated flu vaccines. Did I forget anything? Oh, yes I did. There is an adverse event you wanna watch out for with the flu vaccines. If you develop Guillain-Barré syndrome within 42 days, and we think of 4 squads of 2 soldiers coming in here to break up this whole fight, you need to report that. So Guillain-Barré within 42 days. I forget anything?
Not just soldiers, they are.
They're Green Berets, right. So not just soldiers, they're Green Berets, so GB, Guillain-Barré, okay? We are moving over here next. Aren't we going to C-suite?
That's sweet. Well, yeah.
Okay, so now we're here at the I call it the C-suite. This is where our administrators work. It's interview day, all right? We are talking about our pneumococcal vaccines at the moment. I'm sitting down, the first question at my interview is, how many previous healthcare hours do I have? Prev is Prevnar. I have 20 hours, so this is called Prevnar 20. It's a one and done interview. I just got accepted into PA school, so this is a one and done vaccine. My interviewer is a little bit over the hill, they're over 65. So in general, for our pneumococcal vaccines, you need to be at least 65. As I exit this door, somebody comes up and says, hey, in order to be in this program, you need to try out a new vaccine. And so it's called Vaxnuvance. So they give me that shot there. I need to take a breath. And they say, when you come back in 1 year to start the program, we're gonna give you the second shot. So I come in, they put this one right in my side and I get a pneumothorax from this. So this one is called Pneumovax. So you get Vaxnuvance first, and then a year later, you get Pneumovax. So that's a 2-shot series. Now, for pneumococcal, if you are under 65, there are certain risk factors that indicate getting this vaccine. Included asplenia, we've heard some of these before, CSF leak, cochlear implant, heart disease, liver disease, diabetes. So just general things that make you unwell, you can get pneumococcal under 65. Anything else? All right, lab next. You don't want to be in it? I guess we'll do this door. Okay, welcome to H&P Lab. Today we're working with infants today. All right, so we are doing the Tdap, the tetanus, pertussis, and diphtheria vaccines. Okay, we're working with 6 infants today. Don't touch them until the teacher comes in. So this is DTaP. This is capital D, capital T, lowercase a, lowercase p, which is acellular pertussis, okay? We're working with 6 babies, so under 7, you have to be under 7 to get DTaP. Is there anything else with DTaP? I don't think so. Okay, now we're gonna go to Tdap. So this is capital D, lowercase DAP. This is for adults, anybody under 11. So I think of having T and I'm spilling it on an amplifier that goes up to 11. So it's the big T here. This is very important because we're not working with babies anymore, we're working with pregnant women, okay? So if you're pregnant and in your 3rd trimester, you are gonna get the Tdap, and you're actually gonna get it in every single pregnancy, you're gonna get a Tdap shot, okay? Now Chris busts in, okay? He's gonna be adding a jail cell to the H&P lab. So this is a booster shot, so he boosts in, or he's wearing boots, or he's dressed as a ghost and saying boo. So this is a booster shot. It's called Adacel, He's also playing music with this amplifier, so it's going to be 11, but not too loud, so he's going to keep it under 64 for the older people. So this booster is between 11 and 64. Now the Trix Rabbit comes in, all right? Also wearing these boots. This one is another booster shot. It's called Boostrix, and it's for anybody over 11, okay? Now we have, the Trix Rabbit is going to catch a touchdown pass. So this is the TD vaccine, capital D, lowercase d. And just real quick, the letters are very important here because if they are capital, it's kind of a full strength or a stronger version of this vaccine. Lowercase is a weakened version. So the letters are very important here, okay? After he catches this touchdown, he's interviewed by some men, and they ask him again about his previous healthcare experience. So if you are allergic to the TD vaccine, you cannot get the meningococcal vaccine, and you cannot get specifically Prevnar 20, which is one of the pneumococcal vaccines that we talked about. We have one more here. This is the tetanus immunoglobulin, okay? So because the Trix Rabbit was on the other team, you're gonna grab like a globe and kind of stab him with it. You're gonna give him this real contaminated wound. The tetanus immunoglobulin is indicated for contaminated wounds if either you don't know their vaccine status or they're not fully vaccinated. You can give them this immunoglobulin. Is there anything else with that? We're ready to leave to do the adverse event for this. As you are leaving lab, you bust up your arm and your shoulder. So there's an adverse event here. It's brachial neuritis within 28 days. Because, thank goodness you don't have to come back to lab for another 28 days, or you have this zombie arm 28 days later, okay? All right, let's head this way. So you notice a chicken running over here into the SP lab. Actually, two chickens, and they're quite lively. So we are talking about varicella zoster or chickenpox. Okay, so they're two chickens because this is a 2-dose series, and they're lively because this is a live attenuated vaccine. Okay, I come up to the door and I actually noticed they're having a 1980s themed party. Because if you were born before 1980, you do not need this vaccine. You're considered immune, okay? As I walk in, one of the employees here walks out with some neon jello. So if you are allergic to neomycin or gelatin, you should not be getting this chickenpox vaccine. What's the thing with pregnancy here? Not
You can't give it for pregnant people,
Yeah.
and you would give it if they were born before the 80s, but they were a healthcare worker.
Yes. So if you were born before the 1980s, but you work in healthcare, you still want to get this as well. Okay. Is there anything else with that one? Okay. Now we're going to actually walk further into the SP suite, and we're standing outside our door. We're going to see a patient. So this is going to be for shingles. So, backing up for a second. Those chickens were running very fast. It's called Varivax. So the chickenpox vaccine is called Varivax. Okay. Oh, and it's sub-Q as well, subcutaneous. Thanks. Now we're going to go in. We're actually going to see a patient. So our doorway information, we have a female who is over 50. Before the 2 minutes is up, the door opens up. She comes out and she kicks you in your shin. All right. So this is called Shingrix. And she says, I'm going to come back 6 months later. I'm going to kick you in the other shin. So Shingrix is a 2-dose series, one today and one in 6 months. She's angry because you tried to give this to her and she's pregnant. So you do not want to give Shingrix to a patient who is pregnant. Okay, that's it for shingles. Okay, so now, did you have something?
Wasn't there something with her age? Over 50?
Over 50, yeah, I think I said that.
Oh, okay,
Yeah.
okay.
Yeah, so you want to give this to people over 50. Now we're going to see one more patient. okay? This is going to be, you see guards, 9 guards standing in front of 3 doors, okay? So this is for HPV, and it's Gardasil 9, okay? So you have 3 doors. So your first patient, you open the door, she kicks you in your hip. So I think of like hip of a HPV, just to kind of remember that, okay? She is less than 15, and she's also going to come back and hit you in the other hip 6 months later. So 2-dose series, 1 today, 1 in 6 months. Door number 2 is there's 15 members of the San Francisco 49ers. So this is going to be between 15 and between 49. They have 3 games coming up, 1 today, 1 in 1 to 2 months, and 1 in 3 months. So that's the vaccine schedule for that age group.
6 months.
Oh, that's 6 months. So 1 today, 1 in 1 to 2 months, and the third one in 6 months.
Yep.
Okay. Door number 3 is going to be an HIV positive patient. Age really doesn't matter here, but if they're HIV positive, you want to give them the HPV vaccine. Also a 3-dose series. You're actually going to give them tickets to the 49ers game. So today, 1 to 2 months, and 6 months. That's HPV. Okay. Oh, where do we go next?
Lab.
Oh, anatomy lab. Oh. Wait.
It's that way.
Okay. Let's go. Fast forward. Come on.
Oh. Your video is getting real wobbly.
It's exciting.
We'll just go into like the area here. Okay, so we're standing outside of our anatomy lab here, ready to do our dissection, but we see a live donor, and they're actually a time traveler. So this is going to be, so they're a time traveler from 1957, okay? 1957, which is the year that Sputnik launched, and it was broadcast on MMR radio. So this is for our measles, our mumps, and our rubella. So we have a time traveler. They are pregnant. 1957 is important here because if you were born before 1957, you should get the MMR vaccine.
No.
You should not
If
get
you were
it.
born before, you should not.
Oh,
Other way. So if you were born after, you should.
if you were, sorry, say that again.
Post 1957, you do need it.
Yeah, I think that's what I said. If you were born after 1957, you should get the vaccine. Okay, yeah, sorry. Okay, so she's pregnant and she says, hey, do I need this vaccine? And you say, not right now, but once you give birth, we're gonna give you this vaccine, and we wanna give it to you before you're discharged from the hospital. Okay, I think there's some other things here. I then suddenly notice, hey, I'm a healthcare worker. I work around, if I'm around like immunocompromised people, if I'm gonna do some traveling, I'm also going to be getting the MMR vaccine. Other than adverse effects, did I forget anything with MMR?
Once you leave.
Yeah, okay, all right. As I leave the anatomy lab, 2 things are gonna happen. The first thing, somebody's gonna take a ruby and stab me in 6 of my joints, making them weak. So, the adverse effect for rubella is if you get joint weakness within 6 weeks, okay?
Chronic arthritis.
Chronic arthritis, okay.
Within 6 weeks is what you have to report.
Okay, all right, within 6 weeks, thanks guys. And then Measly Ron Weasley is gonna come up, all right? This is for the measles, and he has 1 plate, and you're like, dude, that's not enough plates. You have low plates to fight Voldemort, right? So the adverse reaction for measles is going to be thrombocytopenic purpura, because you're also like, Ron, you just started bleeding, like what's going on? And that is, hold on, don't tell me. You looked at your watch and it's 7:30, so that's within 7 to 30 days, thrombocytopenic purpura for measles. That's it for that, right? All right.
Do we have one for rubella?
Yeah, he said it.
Oh, okay, cool.
What's our next location?
Aren't we outside again?
Oh,
Your tornado?
Gambit. We have to go to Gambit.
Yeah.
Oh,
Right?
yeah.
But outside, yeah.
Yeah. Oh my gosh. Starting to get rusty. Okay, we are outside 155. We noticed 10 25-year-old men working out their quads. This is all going to be for our meningococcal vaccines, okay? Now, the age group here is between 10 and 25 with some high-risk factors. These men are freshmen in college, they are in ROTC, and they're going to internationally travel. So within that age group, if you have those risk factors, you're going to be getting this vaccine. And it is called, you get one shot, and it's called Menacta or Menveo, because they're all acting crazy, so that's Menacta. Now we see another gentleman kind of in the corner, and he is this super high risk group. So he's eating out of a cooler, so it's E. coolizumab, and he's also eating raviolis, which is ravulizumab. So if you're taking either of those immunosuppressants, you want to get the meningococcal vaccine. You actually want to get 2 shots of this. Also, if you work in a microbiology lab, if you're HIV positive, which I think I already said, or if you have asplenia or
Complement,
if
the
you have-
persistent complement
persistent
deficiency.
complement deficiency. So any of those factors puts you at like a super high risk, and you're going to get 2 shots for that. That's meningococcal. What's up? Oh, and then if you're at that super high risk group, you're going to get a shot every 5 years as well, pretty much for life. Okay, let's head on inside. Oh man, okay. I'm checking my schedule to see what my Friday morning rotation is going to be. And I see that I'm in the B group. So there's going to be 2 vaccines here that are for the meningococcal B group. I see in this first session, I'm with my ex Sarah. So group B, this is Bexsero, okay? And a heart kind of has like a 3 at the top. So this is a 3-dose series for Bexsero. The second one that I'm going to get here is, give me a second, Bexsero. Okay, so true men move on from their relationships. So true Menba is going to be another serogroup B meningococcal vaccine, and that's going to be a 2-dose series. Is that it for meningococcal?
2 biceps.
2 biceps. Okay, now we're going to walk in here. We're going to talk about hepatitis A. We see 4 people standing here. The first one is going to be Harvey Dent from Batman. So this one, and he's wreaking havoc on the town. So this is called Havrix, all right, and this is for hepatitis A. And then we are going to move on to standing next to him is going to be, her name's Vacta. It's a big vacuum. So this is VAQTA, this is Vacta, also for hepatitis A. Standing next to her is going to be these twins. So it's called Twinrix, okay? And this is going to be a combination Hep A, Hep B vaccine. Now I believe, and correct me if I'm wrong, but the first 2, Havrix and Vacta, you get 2 shots of this. And Twinrix, because it's a combination A-B, you're going to be getting 3 shots of that, okay? Now let's talk about Hep A a little bit. So what these 3 supervillains are going to do, they're going to go all throughout Gotham City, and they're going to be, well, I'll get to that in a sec. They're going to go all throughout Gotham City. They're going to be giving this vaccine to the homeless, people who are like sexually promiscuous, IV drug users, things like that. Okay, there's a 4th person here as well. This is our immunoglobulin. So this is gamma stan, so it's G-A-M-M-A, capital S-T-A-N. This is going to be just an immunoglobulin we give to people who have an exposure to Hep A but aren't vaccinated, or maybe they're allergic to the vaccine. And there's one other thing. What is he holding? he's holding 2 globes. One is really small, so you're gonna give this to people less than 1 who have an exposure, and then the other globe is greater than 40. You're gonna give that to people greater than 40 with an exposure as well. And then is this with the apes? Yeah, so there's also something interesting here with Hep A. Their big arch nemesis is a big ape. So if you work around primates with like Hep A, you wanna get this shot as well. Now, before we head down, we're gonna have Neo bust in. So Neo is gonna come in and choke all of these people out. So if you are allergic to neomycin, you do not wanna get the Hep A vaccine. Good? Okay. The other thing, just because we were out there with meningococcal, remember, if you are allergic to the TD vaccine, you do not wanna get meningococcal. Okay, Hep A? All right, let's head down for Hep B. Okay, we have 3 people standing here. The first one is Bumblebee from the Transformers. And his engine, he's in car form with his engine showing. So this is called Engerix, okay? The second one here is going to be Puff Daddy, Sean Combs. He is combing his hair constantly. So this is called Recombavax. To his right is our third Hep B vaccine. And this is Lisa Kudrow, who played Phoebe on Friends. So this is Heplisav, I believe, Heplisav, okay? They're rating you on your SP encounter. So they hold up a 3, and then Lisa gives you a 2 because you like The Office more than Friends. So Engerix is a 3-dose series, Recombavax is a 3-dose series, and then Heplisav is a 2-dose series. The big thing here is if you are allergic to yeast, you do not want to get a Hep B vaccine. And who do we give Hep B vaccines to?
Immunocompromised or people
Going to school.
healthcare, school.
Okay, so yeah.
You get anaphylaxis with yeast.
Oh, with yeast. Okay.
And these 3 vaccines.
Yeah, so yeast and these vaccines don't mix. You'll get anaphylaxis if you're allergic to yeast. Yeah. So you want to give this to immunocompromised students, things like that. And healthcare workers as well for Hep B. Anything else? Okay. All right, we're almost done. We're going outside now? Maybe.
Depending, you might want to do it inside.
Huh?
You can step out this door.
Yeah. Maybe
It's
we'll
really windy.
Yeah, maybe we'll just do it right in the hall here. We'll do it in the vestibule. Okay, so as we are leaving, we're like, we've had enough of all this madness. We are leaving for the day. So we walk outside and Dr. Silver comes out and says, hi, you got a B on your exam. Then he promptly rips out your spleen, but then very kindly gives you some stem cells. So this is your H influenza B vaccine, so high, and then you got a B. You only get this if you do not have a spleen or you are on stem cells, okay? Then we move on. We finally get into our car. We're gonna talk about RSV, all right? So we have combat boots on. This is a recombinant vaccine, and it goes 60 miles an hour. So if you're over 60, you wanna get this vaccine. You're also putting the window down to get some breeze here. So it's called Abrezvo, I believe, is this RSV vaccine. And I think that's all for that RSV vaccine. Oh, there are actually some other things too. Your pregnant wife is in the back seat. She's in her 3rd trimester. So you want to give this vaccine to women in their 3rd trimester, all right? So for RSV. Also, some other things here is your car starts sputtering a lot. So some risk factors are high risk population here is if you have like COPD, asthma, CAD, and CHF as well. And there are some pretty interesting adverse risk factors here, including AFib, and then another big one is potentially preterm birth. So you want to be careful there. All right, as you're driving your car away, a T-Rex comes or you get in a car wreck and picks up your car, which is an RV, by the way, for RSV. So this vaccine is called, it has a Rex in it, a Rexv, I believe it's called a Rexv, okay? This is like the adjuvant vaccine for RSV. So it's gonna pick up your RV and it's actually gonna swallow you, because next we're gonna talk about rotavirus. So rotavirus is, you're kind of rotating in the gastrointestinal tract of this T-Rex. So intussusception, pulling the intestines into another part of the intestines where they don't belong, is going to be the big adverse event here. If you get this within 21 days, you want to report that. I think that's it. All right, that's it. That's all I got for you.
Yellow fever.
Yeah, we'll throw this one into, so big bird, big yellow bird, putting an egg down your throat. So if you are allergic to eggs, you do not want to get the yellow fever vaccine. That's it.